So what exactly, like what would the financial requirements be for starting a practice? Like if somebody today said, I want to start a practice tomorrow, what are the things that they're going to need to pay for, and what are the ways that they can manage those costs? I know we've talked about maybe getting like a loan from the bank or something like that, but what all fits under that umbrella?
Yeah, yeah. This is where the business plan and budget comes in, because depending on what you're planning to do will help you figure out those startup costs. For example, if you want to rent a space, and you need to furnish it, you need to make sure your licenses, you need to have if you're going to do telehealth, you need to have a computer and technology set up. It's pretty easy to put down the cost for all those items and then know what those startup costs will be. Given the advent of so many telehealth services,
Right.
we're so lucky to be in this field that most people already have a computer and a setup. So your only startup costs for doing a business are getting whatever licenses you need, getting your malpractice insurance, and paying for the telehealth video solution, which could literally be less than a couple $100s.
Yeah, it makes me think about internet service provider. In your experience doing telehealth visits, is it worth it to spend a little bit extra money on having more high-speed internet to make sure that's as stable as possible? Or, well, I don't know. Maybe you already pay for the high-speed internet. Yeah, it's just a question of whether it's right for you to consider a standard internet plan being good enough in order to support that, or if it might be worth to spend an extra few dollars a month to support your business, given telehealth can be such a crucial element.
Absolutely. And this is one thing we can thank the pandemic for a little bit, is that so many people working at home now has pushed costs down, actually, and has increased some of the stability, I feel, of internet service providers. I would definitely splurge for whatever the best internet speeds are if you're going to be doing a telehealth practice. And often it's a good point to bring this up, because I'd say, we often get very good download speed from our internet service providers. And they're very keen on this, because if you're streaming shows, you need to have good download speed. But as a mental health provider, you need to pay very close attention to your upload speed,
Right.
which is the speed you're sending out video. And on some level, the upload speed is more important than the download speed, because you want to make sure your patients don't miss what you're saying or don't have a choppy connection from you. They're just not going to come back, or they're going to miss something important in their treatment. So theoretically, having 15 or 20 megabit upload and download speed should cover very high definition video transmission. I would say in experience, however, being at 100 megabits per second upload and download is much safer, and there are plans that can go far above that.
Right.
And usually not at great expense. I think for our nonprofit agency right now, our Comcast internet bill is $85 a month for very fast speed, and hopefully it's similar around the country to costs like that.